Hey Savvy Social Workers, welcome back to our DSM-5 series, and today we are going to get into some trauma and stress disorders. However, only the most common ones that you're likely to see on the ASWB exam. So we are going to kick this chat off with reactive attachment disorder, which is usually a failure to bond. A child who experiences neglect, abuse, or separation during the critical stages of development of the first 3 years of life is at risk of developing an attachment disorder. So that's the first thing to know, that anytime from birth to 3 years, if you have a child that experiences neglect or abuse or any type of separation from their caregivers during those critical stages, during that critical age, they are at a high risk for attachment disorders. Reactive attachment disorder is diagnosed when a child's social relationships are inhibited, and as a result, he or she fails to engage in social interactions in a manner appropriate to his or her developmental level. So that looks like, a failure to bond with others. So that could be caregivers, that could be friends, that could be other associates, just kind of being ambivalent about interpersonal relationships. The child may exercise avoidance, hypervigilance, or resistance to social contact. The child may also avoid social reciprocity, fail to seek comfort when upset, become overly attached to one adult, and refuse to acknowledge a caregiver. So whenever a child is diagnosed with reactive attachment disorder, they are again failing to reciprocate the bond with someone else, or someone else is trying to nurture them and they are not, they're not reciprocating that at all. Or they may become overly attached to one person, and that's out of the fear and insecurity of the neglect or abuse that they have experienced. So if this one person has been consistently made them feel safe, then they are likely to bond to that person. But they're also likely to just refuse or acknowledge their caregiver at all. So these links that have been shown between reactive attachment disorder and behavioral problems in relationships in the future. So on the exam, you may have someone that is in their 20s that are struggling with relationships, and it could be due to these attachment disorders that were developed early on in life. This is a common disorder for children who spent their younger years in foster homes. So I've seen a lot of practice questions where they will give you a scenario where a child has been abused or neglected and sent from foster home to foster home all before the age of 5 or all before the age of 3. This is a classic sign for reactive attachment disorder, because during this period of time when they are supposed to be bonding and building that trust and security, according to Erickson's psychosocial theory, we do the trust versus mistrust throughout the first year of life. They are being passed around, they are being abused, or they're being neglected. So they're not developing these bonds with their initial caregiver. So this is causing some reactivity later along in life. So for exam purposes, just know that this is highly common for a child that was abused and neglected in their first few years of life, or have spent a lot of time in foster homes. Next, we're going to chat about post-traumatic stress disorder, or PTSD. PTSD is an anxiety disorder that develops in relation to an event which creates psychological trauma in response to actual or threatened death, serious injury, or sexual violation. So I know a lot of us are familiar with PTSD, but I want to stress that PTSD can be seen in many different forms. However, the exposure must involve directly experiencing the event, witnessing the event in person, learning of the actual event or threatened death of a close family member or friend, or repeated firsthand extreme exposure to the details of the event. So you can get PTSD. So simply put, if you are involved in some type of traumatic experience, if you witness, let's just say if you were involved in a car crash, a bad car crash where it left, you paralyzed, or someone in the accident passed away, or you witnessed this happened, or you learned that this happened to someone in your family, your close friend or your close family member that was involved in this situation, or repeated firsthand extreme exposure, as in the case of being a therapist or being an EMT, where you are constantly seeing these traumatic accidents and you're having to work them, being a doctor or a nurse. All of these professions put you at risk for PTSD because you have the repeated firsthand extreme exposure to the details of the event. People are coming and telling you over and over what is happening in these traumatic events. Okay, a formal diagnosis of PTSD is made when the symptoms cause clinically significant distress or impairment in social and or occupational dysfunction for a period of at least 1 month. The symptoms cannot be due to a medical condition, medication, or drugs or alcohol. So it has to solely be based off of the trauma of an event and not exacerbated by anything else. And again, I'm going to highlight that they have to have these symptoms for at least a month before we can consider the diagnosis of PTSD. So on the exam, if you are experiencing some type of trauma, or the client, shall I say, is experiencing some type of trauma and it has only been a few weeks, then we are not qualified yet to diagnose them with PTSD. There's another diagnosis that we're going to talk about in a minute, but just remember that PTSD, the symptoms have to be present for at least a month. Here are a few other important things to note about PTSD. The traumas experienced may involve war, natural disasters, car accidents, sexual abuse, and domestic violence. All of these are under the diagnosis of traumatic experiences that will qualify a person for the diagnosis of PTSD. So any type of veterans or any type of soldiers that experience war, anybody who's experienced a natural disaster, hurricanes, tornadoes, floods, all of those things. Like I said before, traumatic car accidents, someone who has been sexually abused, or someone who's experienced domestic violence, whether it be one time or many times, that is still traumatic experiences. PTSD symptoms may include nightmares, flashbacks, sleep disturbances, mood disorders, suicidal ideation, avoidance, and hyperarousal in response to trauma-related stimuli. I also want to add here any type of instances of detachment. Anytime that there is some type of detachment present, you can very well couple that with some type of trauma. Okay, so in the STEM, this is important to know, because in the STEM, they are likely to provide you with these symptoms. A scenario that has the following symptoms: either the client is having nightmares, or they're having trouble sleeping, or they're having suicidal thoughts. All of these point back to some type of trauma. So of course, if you're doing an assessment, you will want to evaluate them for these respective traumas before you actually try to recommend them for a psych eval or something like that. Let's assess them for traumas. Whether if they came in because they're having sexual issues, then we want to assess their sexual history. If they're coming in because they're having interpersonal issues, then we want to assess their social history, see what kind of trauma was in there before we try to refer them or diagnose them, because it could just be trauma. Remember, we always want to get to the root of the issue first. PTSD is often comorbid with substance abuse and mood disorders such as depression and anxiety, requiring a more complex treatment approach. Okay, so for PTSD, we normally use, CBT, DBT, sometimes exposure therapy, just depending on the nature of what the trauma is. So just remember that it is common for someone who has experienced some type of trauma to also have an issue with substance abuse, because sometimes that's what they use to cope, or to have mood disorders, because the triggers, they come and go. So just know that these things are highly likely as well as very common with people who are struggling with PTSD. So I'm bringing you back up to this slide because it's going to lead me into my next slide, but I wanted to again emphasize that in order for PTSD to be diagnosed, it has to be for a period of at least 1 month. Now, if we have these traumatic stress symptoms that are present, but they haven't been present for a month yet, then we will diagnose that with acute stress disorder. This is a mental health problem that can occur in the first month after a traumatic event. So usually they'll say between the third day all the way up to a month. But for me, I just would just, for exam purposes, I would just say anything less than a month, we refer to that as acute stress disorder. So you have post-traumatic distress disorder, which is more than a month, acute stress disorder, which is less than a month. Similar symptoms, almost the same symptoms. It's just the only difference here is duration. The symptoms of ASD are like the symptoms of PTSD, but you must have them longer than 1 month to have PTSD. That is the grand distinction there. So less than a month is acute stress, and more than a month is post-traumatic stress. Again, I hope that these were helpful for you. Let me know in the comments if they were. These are the most common. So of course I don't want to kind of bore you with going through all of the diagnoses that you're probably not even going to see on the exam, but the most common ones that people are telling me they're seeing on the exam, I try to put them in these videos so you can have one neutral space to study and refer back to. So let me know if there's anything else that you kind of want to see or you need a review on. I'm happy to visit that for you. Again, thank you for being here. Please like this video, subscribe if you're not. Your likes and your comments allow me to be able to continue to make these videos, get these videos out to y'all. So please continue to share the videos with other colleagues. And again, thank y'all for being here, and let's continue to get those passes the savvy way.